Thank you for joining us for this COVID-19 telephone town hall. If you'd like to ask a question, simply hit *3 on your phone and an operator will come and take your question. If you're listening online, you can type your question into the question box on our website. We are just beginning to dial out to households across Arapahoe County, and we want to give folks a moment to join the call. Hi, my name is Erica, and I'll be your host tonight. This is the 7th town hall that Arapahoe County has hosted since the start of the COVID-19 pandemic. Our goal is to bring you critical information that can help keep you and your family safe, and also to answer your questions about the pandemic and resources that are available. This week, we're focusing on kids and COVID. First, we'll get an update from Dr. John Douglas of the Tri-County Health Department. He'll provide us with a situational update as well as highlight the newest public health orders released by the state this week. Next, we'll get an overview on what the Colorado Department of Education's efforts are to prepare for school this fall. We also have Brian Ewert, Superintendent of Littleton Public Schools, and Superintendent Scott Siegfried from Cherry Creek Schools to help answer questions from parents and caregivers across the county. Given that the county has 9 different districts of differing sizes and geographies, the plans and procedures for your home district may vary. So please take the information from this event and check with your local district if anything is still unclear. After the opening remarks, as always, we'll take your questions. So, as a reminder, if you're just now joining us, if you want to ask a question, you can press *3 on your phone, or you can send your questions through the website. To get things started, we'd like to welcome Arapahoe County Commissioner Chair Nancy Sharp. Go ahead, Nancy.
Thank you, Erica, and thanks everyone for joining us tonight. We know that many of you are parents who are wondering about the many COVID-related developments that affect your children. We're pleased to welcome guests from the Colorado Department of Education, along with officials from some of the county school districts. They'll be able to answer your questions and give guidance that will help your family get through the summer and prepare for the fall. Thank you again for joining us, and now I'll hand it back to our moderator, Erica.
Great, thank you, Commissioner Sharp. And now we'd like to bring on Dr. John Douglas, the Executive Director of Tri-County Health, for an update on the newest public health orders. Welcome, Dr. Douglas. Go ahead.
Thanks, Erica. Very nice to be with everyone this evening, and particularly nice to be with 2 of our superintendents. I think a focus on kids and COVID is a great topic for the town hall tonight. Let me begin by saying we do have new public health orders. These are part of a progressive reopening of society, so to speak, that the governor has been pushing along. The current set of orders went into effect on Tuesday. We got a final version today. They have a cute name, Safer at Home, and In the Vast Great Outdoors. I actually think it's a good name because I like being in the outdoors. But a big part of the changes that come with the orders include really more ability to do outdoor activity. So specifically, outdoor recreation has been opened up more than it had. We're getting into the summer. It's great that pools are on the list. Day camps have already been allowed, but there's additional guidance about those. Sports teams are allowed to play with certain restrictions on the number of players on the field. Importantly, for members of faith communities, there's guidance about allowing houses of worship to have more individuals. There's specific language in there, and I was glad to see this for the first time, that clarifies some ambiguities, that any business or activity can operate in accordance with what are called general guidelines. And those general guidelines include having less than 10 people in a place at once and the ability to social distance. Now, that may sound like sort of like fine-tuned stuff, but there are a number of entities that are in that category that haven't been specifically called out. And at the health department level, we think those places may be able to open safely, so we're pleased to see that. There are a handful of entities that are specifically called out as not yet being allowed to open. Those include malls, which is a big issue in some communities, bars, brew pubs, things that are serving mostly alcohol, casinos, theaters. We still don't know about residential camps. The governor said he was going to wait until the end of June to make a decision about that. I do want to note that part of the reason the governor's been able to go forward is that the cautious reopening we've had, which has been too slow for many, too fast for some, we're trying to get the Goldilocks just right, is because the statistics about the epidemic in Colorado continue to improve. The number of cases, in spite of increased testing, have continued to go down. That's fantastic. The number of people sick enough to go to the hospital has continued to go down. That's even more fantastic. And those people who get so sick they die has also continued to drop. So those parameters all look really good. I was just on a town hall for Adams County with the head of the state health department, Jill Ryan, and she reminded all of us that we got to take the good news sort of one day at a time, 1 week at a time. We've got a large data team looking to see if there's any reversals in that good news, because we want to be really careful as we go forward. But we're really pleased that these sort of steps are allowed to be taken. I'm also happy that the testing that is increasing allows us as Tri-County to potentially do a better job of alerting people who may have been exposed to infection. Our counties have been supportive of us increasing our contact notification capacity. That means if you got exposed, we want to let you know about it. We want to notify you so you can go get tested yourself, and you can take precautions to prevent yourself from exposing other people. So we're beginning to scale up that capacity, which we think will be a really important part of the continued opening process. Speaking of public health orders, I want to mention two others that actually came out today. One, not part of the larger opening up the business community, but one was an order allowing businesses to insist that clients coming into their store wear face coverings. This is up to the business, and many businesses have been doing it, but it does give some validity to the notion that wearing face coverings or masks can be an important part of preventing transmission in the community. And whether we're trying to take care of our elders or trying to take care of our kids, the more transmission we can prevent, the better. The other order that came out, speaking of our elders, was an order to try to begin to look for ways of allowing visitors into long-term care or other residential facilities. There were terrible outbreaks that occurred in those facilities. That's where many of our deaths happened. And yet the people that are in those facilities now who were protected by not allowing visitors are just really incredibly lonely. And to the extent that we can begin to loosen that up with this new guidance, I think that's a great thing. I guess the last thing I want to say is that we've heard a lot of news lately about vaccine trials moving along faster than anybody had hoped. No one is at all sure when we're going to get a vaccine that works. I think what is clear, however, is that we won't have that by the time we get to August or September, and we desperately want our schools to open. So these other measures I've talked about, careful opening businesses, efforts where we wear face coverings, public health efforts to test and investigate and trace contacts or notify contacts, those are going to be critical to give breathing room for our schools to begin to get back to what they do best, which is educating our kids. Thank you.
Thank you, Dr. Douglas. And if you're just now joining us, a reminder, you can press *3 on your phone to speak with one of our operators and get your question in the queue for the evening. Now we'd like to learn more about how schools are preparing to resume in the fall. And here to give us an update is Colorado Commissioner of Education, Katie Anthems. Good evening, Commissioner. Go ahead.
Hi, thank you so much for having me. I appreciate being here. I appreciate having a few moments to discuss with you sort of the state of education last year and how we're thinking about moving forward next year. I think we all know that the suspension of in-person learning for all of our schools across Colorado last year was really hard for many of our students, teachers, and families. And while I really have to hand it to our superintendents, two of which are on the phone tonight, and teachers for their tremendous work transitioning to supporting students remotely, I think we all agree that in-person learning at schools is the gold standard, and it provides better instruction as well as important structure and relationships for our children. And it also really importantly supports working parents in their need to return to their jobs. So just some context, the Department of Education supports our 178 school districts across our entire state as they work to implement state education laws. But as mentioned, there are many, many implementation decisions and policies that are decided at the local district level. So that's why I'm so glad to be joined by Superintendent Siegfried and Superintendent Ewert today. But toward the end of supporting our districts and helping them make those decisions, we've been working with the Department of Public Health at the state level and the governor's office to provide tools for our schools so that they can reopen safely to as much in-person learning as possible this coming school year. So I really appreciate Dr. Douglas's comments about we're really hoping we can do that as much as possible. We released draft toolkit, and draft is really important. It's not final to help our districts plan for the coming year. It provides a set of options and ideas, and it will include any public health requirements that are necessary as we put new school protocols into place. At this point, it's just really important to remember that much of the health and safety aspects are just drafts, and we expect that to shift over time as the state health department tracks the virus and the local impact on local communities. So a lot of the guidance is going to have to shift over time. I must acknowledge the incredible leadership of our superintendents during this time. There is really no playbook for this, and as Dr. Douglas mentioned, we really all want to get back to what we do best, which is educating our students face-to-face. But none of us has ever gone through this before and had to plan for school next year in such an incredibly challenging environment. So our superintendents have had to adjust and plan as the situation shifts under their feet. So I really hope during this time of immense stress, we can give each other some grace as we navigate these waters together. So with that, I'm going to turn it over to our superintendents to say a few words about their plans.
Would you like me to go first? This is Brian.
Yes, that'd be great.
Okay, this is Brian Ewert, Superintendent of Littleton Public Schools, and I really do appreciate the opportunity to be on the line tonight and to try to answer some of the questions to the degree that we can with so many of the unknowns. We have a rapidly changing environment, a rapidly changing coronavirus guidance. We have to deal with potentially massive budget cuts to our school districts because of the economy and the state budget cuts, and then with all of that, then building new learning models that might have to be hybrid in nature, or continuing on with distance learning, or bringing kids back with new requirements of how kids maintain social distancing. So we have lots of challenges. Also on the line with me from Littleton Public Schools, I have Dr. Tara Hellman. She's the Assistant Superintendent of Learning Services. She's actually leading the Littleton Public Schools Task Force. We're calling it LPS Restart 2021. She has about 75 individuals that are helping us solve for any and every scenario that may present itself this fall. And so as questions come forward around, so what are you doing in the planning, she'll have very specific answers for that. But this is very challenging work, hard work. Something that we've never actually experienced, I don't think, in public education, in the history of public education. And so I think that we are up for the challenge, but we are going to need some patience and grace from our community. Scott?
Thanks, Brian. First, as an educator and a member of this community, I can't miss this opportunity to call on all of us to do our part to end racial inequities in our communities and organizations. I will continue to lead that work in the Cherry Creek School District and our community. It's critical to our success as we move forward. So I'd also like to start by thanking Commissioner Anthems for her work, Dr. Douglas for his leadership, Arapahoe County for including us in the emergency management planning. I also want to acknowledge our teachers and other employees. In 5 short days, went from 70 years of in-person brick and mortar to 100% online and did a great job of it. And I also want to thank our parents and recognize them. They stepped into roles they were not used to either and became partners with our teachers. I am truly proud of our community. I also want to say it wasn't perfect. I am concerned with student learning, mental health, socialization. We have learned a lot from the last couple of months and know we have a short window to plan for the coming year, as Brian mentioned. I want everyone to know that our goal is to restore in-person learning to the greatest extent possible while adhering to public health requirements. We will prioritize the health and safety of students, our 9,000 adult staff members, and every home they come home to at the end of the evening. So we have a group together as Littleton does. We're working across districts as well to get all the best thinking on the table. And we have multiple scenarios that we will start to share with our community in the coming days so they can get a sense of what it might look like as we move forward. Thank you for a minute.
Thank you, Scott, and thank you, Brian and Commissioner. Now let's go ahead and take some calls. Again, you could dial just *3 on your phone. That's *3 on your keypad if you would like to get connected to an operator and ask your question. Let's go ahead and go to our first caller. We have Shelly Thompson, and she has a question for Katie Anthis. Shelly, go ahead and ask your question live.
Hi, my name is Shelly, and my question is for Tri-County Health Department. Can you hear me?
Yes, we can hear you great. Go ahead.
Okay, thank you. My question is, I'm a parent of students at Arapahoe County Schools, specifically Littleton Public Schools, and Mr. Ewart has been very responsive to parents in LPS like me, and has stated that he would like to have students back to school as normal in the fall, short of a requirement by Governor Polis or Tri-County Health Department. Governor Polis has indicated in the last few days that students can be back at, say, 25 students per class with no masks for students and minimal changes in socialization. If Governor Polis does not issue new requirements that differ from that, and if there are no severe spikes in, I know hospitalizations in Colorado are down to 200. They've dropped, as Mr. Douglas stated, they've dropped steadily and certainly have not spiked. And as we know from the data, there's very, very little, if any, risk with school-age children and COVID. And so my question is, if those statistics don't change and if Governor Polis does not issue requirements beyond what we have right now, what date can Tri-County Health Department state that they will let us know whether they will issue separate requirements, not guidance, but requirements for school districts in their jurisdiction? And the reason I ask is there are lots of parents who are contemplating, in order to keep their kids from falling behind and getting their kids back to school, there are parents who are contemplating temporarily moving out of the jurisdiction or attending private school if they can afford it, or some even leaving the state if and so to make those type of plans, can Tri-County Health state by what date they will issue requirements if the current status quo does not change?
All right, and Dr. Douglas, we'll go ahead and have you answer that one.
Yeah, that sounds like it's directed directly at me. Shelley, that's a hugely important question. I hadn't realized some of the stakes for some of the parents were, as you described it, even moving out of state. Let me unequivocally say Tri-County has no plans at all to issue requirements separate from the state if the status quo pertains. So we do not see ourselves, short of an unexpected development in one of our communities, issuing mandates or requirements for schools. We see ourselves largely in the position of offering public health guidance of a general nature, of offering collaboration with schools around the plans they're developing. Everybody's got a different physical plan. It's going to look different in different places. So we very hard for me, honestly, to envision a scenario in which we would issue a requirement that would vary from the state. And if such a scenario were to materialize, it would be, as you put it, different than the status quo by a long shot.
Wonderful. Thank you so much, Dr. Douglas. Let's go to our next live question. We have Mary in Centennial, and her question is for Melissa Sager with Tri-County. Go ahead, Mary, and ask your question.
Yes, thanks for taking my call. I have read the most recent update on churches. I'm concerned about getting both ourselves but also the children back into worship. And I read today's update of June 4th that was on the Tri-County Health that mirrors pretty much what the state directive was. And my question is, I know that Douglas County applied for a variance, and mainly the difference that I see for the variance was the regular ruling is to have 50% of capacity but not to exceed 50 people, whichever is less, and Douglas County applied for the variance and was granted to have up to the 50% of their fire code capacity. My question is really kind of for Arapahoe County and then also Tri-County's feelings on breaking that up. First of all, from Arapahoe County, I wanted to know, has Arapahoe County applied for a variance and just not been granted? Are they considering a variance? And then secondly, when you look at the Tri-County data as of today, for Arapahoe County, 3,800 or so of the cases are actually in the city of Centennial, or Aurora, I'm sorry. I apologize. The city of Aurora, whereas there's only 432 or so in the city of Centennial. And so could a variance also be granted at the municipality level? Thank you.
Those are some really fantastic questions, especially regarding places of worship. So we're hearing this a lot. It's been talked about in a lot of settings about how we can allow increased gatherings to happen in places of worship. And the state actually just released new guidance for places of worship. And I'd encourage you to take a look at the state's website for the full information on that. But as far as spacing and capacity in those facilities, places of worship will be permitted to operate at 50% capacity or 50 people, whichever is fewer. And so places of worship in Arapahoe County will be able to do that. The county is also pursuing variances and moving forward with places of worship. And so do keep an eye out for updates both here on these town halls, but feel free to reach out anytime for additional information on that.
Thank you, Melissa. And now let's go to our next live caller. We have Robert, and he has a question for Scott Siegfried with Cherry Creek Schools. Robert, you're live. Go ahead and ask your question.
Yes, my question has to do with the system in terms of parents, single mothers who have to go to work. What provision is being made by the school system to help the family whose children are not in school, but they have to be in normally after school have a program to stay after the usual school hours. So if the mother is not around, what's going to be arranged for after school provisions? That's my question.
Well, thank you, Robert. I appreciate that and want to acknowledge the very real impact that the last 3 months has had on families of all sorts. And daycare is a very difficult issue. And as we look to plan next year, if the requirements from the state, the health department, CDE, wherever they end up coming from, are that we need to physically distance our schools, the fact is we're not built to be physically distanced. We're built to have kids in close space together. And so if we are, then not all kids can come to school every day. And if that's how far we have to stretch out to physically distance, then daycare is a very real issue that I don't know if we'll be able to support. Now, we're looking differently at elementary versus middle school versus high school because there is a different impact for different ages of kids, and our ability to provide daycare or aftercare, as you suggested, we're still working on that. So I don't have an answer, but it all comes back to what are the requirements that we will have to plan for in the fall. If the requirements are very different, as the governor has said to some groups, that it's 25 in a classroom, that might allow us to do the different things at elementary school. If it's 6 feet, as currently is that everybody talks about, that's a very different standard. And so what I'm hoping is we get very clear guidance very soon, because the real implications from the prior caller and you, Robert, are very real. And we need opportunities to plan our systems and to communicate effectively what we can do, what we can't do, so you can also plan. Thank you.
All right, our next caller is Marcella, and she has a question for Dr. Douglas. Marcella, you are live. You can go ahead and ask your question.
Yes, my daughter will be a senior at Littleton High School. I am a registered nurse, and I work on a skilled unit. My employers have just started weekly testing. I've already been tested twice, and then this week. So my concern is, or my question would be, I know these teenagers they don't get the COVID-19 as frequently, but what about the teachers and the other support staff? Will they be tested weekly?
Marcella, thanks for the question. I'm glad you're able to get tested weekly. That's a direction we'd like to see lots of places go in. There is interest, certainly I have interest, I think the schools have interest as well as to what regular testing of staff could look like. Those plans have not been developed yet. I think it's going to depend on testing supply and probably resources. You heard Superintendent Ewert talk about the fact that the budget is, just creating a huge hole. So we're going to be looking hard at that, although at this point there's no firm plans that have been developed.
Wonderful, thank you. And again, if you'd like to ask a question this evening, just press *3 on your phone and you'll get into the queue, talk to an operator, and get the chance to ask your question live. Okay, next we have Quentin, and this question is for Katie Anthos, or as well as Superintendent Scott Siegfried. Whoever would like to go first. Quentin, you can go ahead and ask your question live.
Okay, hi. My question I need to preface this a little bit. I came into the conversation late, and I heard a description of face-to-face or on-campus teaching and learning as the gold standard. And my question is, we really haven't done that for very long. And how can you kind of? I don't think that remote teaching has been really exhausted. So how can people decide at this point if it is in fact the gold standard?
I can jump in there real quick. Thank you for the question. I look at education and what we work to do on a daily basis to provide the right opportunities for all students. Some students do learn better online or remotely. Some don't, or many don't. Many learn best being face-to-face with a teacher, and that's our goal for the majority of students. I think most districts will try to stand up next year true online opportunities for kids and families that are fearful of coming back or don't want to come back and potentially deal with the alternating schedules we might have to put in place. And I know we're also all working on really ramping up our remote learning, because we all know that the virus might come back and we might all have to go back for months of remote learning. So we're moving from things like hold harmless to hold accountable, from not grading to ways that we can take attendance as opposed to where we didn't take attendance, because now we have time to plan. So our goal is to make everything we do much more robust as we enter next school year, whether it's remote, whether it's online, or whether it's face-to-face.
Wonderful, thank you. Let's go to our next question. We have Monica. Monica is in Aurora, and Katie Anthos, you can go ahead and answer this question if you'd like. Monica, go ahead and ask your question live.
Hi. Starting with the graduating class of 2021, new graduation requirements were put into place by the Colorado Department of Education. These requirements make students to demonstrate that they have readiness for college and career readiness for them to graduate. My question is, are you considering going back to the regular graduation requirements, which only require the amount of credits, or are you going to continue with the kids that have to be prepared to go to college and career placements?
Yes, thank you, Monica, for the question. It's a great question, and those requirements, along with probably many others, are things that we're going to have to look at, and our State Board of Education will have to look at as well. We have not made any decisions on changing graduation requirements right now. I can tell you that the State Board of Education is going to be discussing that very soon, but right now no changes have been made.
Great, thank you. Another question for you as well to the Commissioner of Colorado Education, Katie. This is Debbie in Aurora. Debbie, you're live. Go ahead and ask your question.
Hi, my question is about the budget. I know that the City of Aurora and Adams County, Arapahoe County have been tremendously impacted through current events. So my question to you is, where do people like me who have never gotten into politics or policy making, who do we contact, where do we go, who do we ask, what kinds of questions do we ask about keeping our kids from being shorted on the budget? How do we keep the educational system from being negatively impacted by budget cuts? Thank you.
Thank you so much, Debbie. That is such an important question, and I know one that our superintendents are really grappling with right now. I would say that my advice would be to talk to your local representatives. In Colorado, the state budget is determined and decided by the Colorado legislature. And they do have some very challenging constraints with constitutional amendments and other constraints that they have to abide by when they're determining the budget. But we do think it's important for you to call your local legislator and tell them how important you think public schools are, so that when they're making tough decisions, they can do the least amount of damage as possible to our public school systems.
Great, thank you for answering that one. Next we have Sherry. Sherry has a question for Scott Siegfried with Cherry Creek Schools. Sherry, go ahead and ask your question live.
Hi, thanks so much. I was wondering, I know that you had put out a survey for Cherry Creek School parents of what the remote learning and the future of the school might look like in the future. And if students, or I should say as a parent, do not want to be exposed and have to go to, say, a part-time schedule, and we would want to do total remote learning, would we be hindered and in our success of learning if we wanted to do 100% remote learning? Is there an option for that? Thank you.
Thank you, Sherry. Yes, we do have Elevation Online High School and Middle School that is a accredited school through the Colorado Department of Education that is fully online, and it's a great, very successful, robust program that's already up and running. We are also working to develop a kindergarten through fifth grade fully online program that will be as robust as those that are in the classroom. For that to work, however, we will need waivers from the Colorado Department of Education to be able to count those students, be funded for those students and be able to pay the teachers to teach those students. But yes, we think it's an important option that all parents have a choice to keep their kids fully online through this time. Thank you.
Wonderful. Thank you, Scott. And now let's go to an online question. We have Kristen. She has a question for Dr. Douglas. And she says, mental health is of a huge concern for Colorado kids. How are the risks of isolation and diminished mental health being weighed against very minimal COVID-19 risk for young people? Dr. Douglas, go ahead.
Really important question, Kristen. Thank you. I'd say it's being weighed very heavily. I think there may be a perception that all that public health cares about these days is getting COVID numbers down, and even one number is too high, and we need to sacrifice everything for that. Nothing could be further from the truth. Mental health is a core bread and butter public health issue. We one of our major priorities as a health department, actually, before we started getting into COVID, was mental health. So, huge issue. We're balancing it. We're really attentive to it. Honestly, that's why I am such a, well, at least in part, such a fan of doing whatever I can as a health department to help our schools get as open as possible. That's not all that's needed for mental health. Access to health care, people being willing to go and seek health care is a critical part of it. But let me just qualitatively say I couldn't agree with you more about the importance of both the balance as well as mental health as a critical health issue.
Thank you, Dr. Douglas. This is Scott Siegfried. If I might just comment on that, we do hear quite a bit about the minimal impact on students. But when I hear that, I also have to think about the impact on the 9,000 adults that I have that work in schools, some with their own underlying conditions, some older that could be more impacted. And it's my responsibility to be as thoughtful of them as it is everybody that comes into the schools. Thank you.
Thank you, Scott, and thank you, Dr. Douglas. Okay, next we have Caitlin. And this question is for you, Dr. Douglas. Caitlin, you're live. Go ahead and ask your question.
Thank you. This fall, I will have 2 middle schoolers in Cherry Creek, and I am very supportive of returning to 100% in-person learning for the fall. I'm calling about face coverings as part of the in-person learning protocols. The draft toolkit from the CDE states that schools should consider cloth face coverings for students, and that face coverings should be worn by staff and students as feasible. Governor Polis recently told the Colorado League of Charter Schools that he doesn't know how realistic it is for students to all wear masks. So although I appreciate Dr. Douglas's response to Shelley's earlier question that Tri-County has no plans to issue guidance different from the state, the fact is that Tri-County has not always followed state guidance during this pandemic. The best example, of course, is when Tri-County extended the stay-at-home order for Arapahoe and Anthems, even though Polis had announced a transition to safer at home. So I hope you can understand, Dr. Douglas, that some families are nervous that something similar may occur as it relates to health and safety guidance for schools. So I have a 2-part question for you, Dr. Douglas, or the team. Number 1, what is Tri-County's position on whether K-12 students should be wearing masks at school? And number 2, who will be making the final decision on that issue for the school districts represented on tonight's call? Thank you very much.
Well, okay, 2 questions. Let me take the first one. What's our position? Our position is that we think wearing face coverings or masks as much as possible is valuable in reducing transmission and potentially reducing acquisition. We have not chosen to mandate wearing face coverings or face masks in any of our counties. We were asked by a number of different cities to consider that. We felt that was not an appropriate mandate for us as a public health department and chose not to do that. And I don't foresee us doing a mandate of the schools in that area either. I would say that there's a lot we are learning about, how long can you wear a mask before you need to take it off and breathe? What do the different fabrics have to offer? How many feet apart do you need to be and you can really more easily wear a mask? I think we're learning as we go. I do think that everything we're seeing about it suggests it can be helpful, but like most things, this is something we're going to have to take and work within the context of the schools for both the staff as well as the students.
Thank you, Dr. Douglas. All right, let's go to our next question. It is an online question from Jenny, and she says, will CDE please change requirements for minutes of contact, since she says staying alive and healthy is probably more important than keeping students corralled in buildings for a certain amount of time? Go ahead, Katie.
Yes, thank you, Lauren. That's a great question. We did actually give a waiver for all of our school districts this past year for minutes, and we are looking right now at adjusting that policy to make sure that we can, just as Superintendent Siegfried said, just so we can support our districts in the myriad of different learning opportunities they're going to need to do. So if they have remote learning, you know, we're not going to be counting minutes. That was a policy, you know, from a long time ago that doesn't really make sense in this new world we live in. So we are looking at how we can adjust that and be more flexible for school districts moving forward.
Wonderful. All right, our next question is going to be Heather, and she's in Aurora, and her question is for Tara Hellman, who's with Littleton Public Schools. Heather, go ahead, you're live.
Hi, I am a teacher in Aurora Public Schools, and July is when I plan out my whole entire year. So I know Tri-County Health is talking through things, and I know Governor Polis is as well, and thinking through things, but what are we, as far as setting a date, are people realizing how this impacts teachers? Because how I have to plan to teach in person is completely different as to how I have to plan to teach online, especially being a music teacher. So are we considering that for the teachers? Because for me to be the best teacher, I need to plan way before the school year starts. Thank you.
Great question, Heather. Thank you for asking. And yes, we are taking all of those pieces into consideration, because as we have found over the past 2.5 months, that everything that we have done in terms of moving from bricks and mortar to online, we have multiplied that by 5 steps for sure. And so at this time in Littleton Public Schools, we have a team of facilitators that are looking at 5 particular scenarios for which we will need to perhaps toggle, whether that be complete distance learning, or return to bricks and mortar, or some fraction of a 1 to 10 ratio, 1 to 15, or perhaps 1 to 20 or so, depending upon what those standards will be. And so we are building in Littleton Public Schools a framework for teachers and principals to really undergird that work, so that much of it can be done, so that when teachers come back, they then are able to really put their stamp and utilize their art and science of their craft to be able to really focus on the prioritization of the standards, et cetera. And so we're working very quickly, and so we have a pretty robust timeline for all of those different pieces, and we hope to really have that done by mid-July, because of course I certainly understand from being a former teacher as well, that time is of the essence. So we're working just as quickly as we can. So thank you very much for the question.
Thank you, Tara. Next, we have another online question. This is Caleb, and his question is for Brian Ewert, the superintendent of Littleton Public Schools. He asks, what if we as parents don't feel that the climate is suitable to reopening when school reopens, but the district disagrees?
Yeah, Caleb, that's a great question, and one that our task force is actually dealing with, because we know for a fact that we have kids out there whose health is compromised for issues like asthma and other things, that parents simply aren't going to feel comfortable coming back in fall when we open. So the task force is also charged with trying to understand what sorts of models can we build where, if we are able to open our brick and mortar buildings, but kids actually need to ebb and flow inside and outside of those classes, and can we build a model in such a way that our teachers are not only presenting in class, but those kids whose health has been compromised can actually attend class outside. So all of those issues are being explored. I can't sit here tonight and say that we've solved for all of those issues. We also know that we will have parents and kids that want to attend school full-time online in a distance model. So another piece of the task force is for our group to explore what does an online, a fully online program look like in Littleton when we don't have an accredited online school. We have some programs where we have kids online most of the time, but we would have to do a mad scramble in Littleton Public Schools to get an accredited online program fully built out by fall.
Wonderful, thank you. Our next caller is Pam, and this question is for Katie. Pam, you are live. Go ahead and ask your question.
Hi, this question is actually for Scott Siegfried, I guess. I have two boys that go to Grandview and go to CCIC, and they have IEPs. So they're pretty high-functioning special ed kids for the most part. But the back and forthness of all of this day you go to school and this day you don't go to school and this is online and that is not online, I mean, it greatly impacts their learning. And they're not even like the severely autistic kids and things like that. These kids all have to require to meet federal guidelines, which is huge. So that's above the state level. And I'm really concerned about the education because they do want to go on, but their education has slipped so much during Corona, and education is hard for them in general. I mean, how is that going to be addressed with these kids that you're trying to meet federal guidelines of the IEP process, but yet we're having this back and forthness of school? I mean, it's very hard when you have kids with these learning issues.
Thank you, Pam. Absolutely, and I'll make some comments, and I would like Katie have an opportunity to talk about any guidelines or adjustments that can be made at state or federal or what they're working on. First, through this time, my heart has really been centered around the students that has had a most disproportionate impact on: English language learners, special education students, kids in poverty. There are some students that are more heavily impacted by what's happened and what potentially will continue to happen than others. And we're working hard to be thoughtful of that. As we go forward, if we have to do a blended learning model, do some kids come every day while others don't? How do we make up some of that additional time? Providing extended school year support for students right now virtually. So we're trying to look at different ways, but you're absolutely right. It is difficult in this back and forth, full remote, in class sometime and not, for students that have those additional needs. And so we're not perfect at that. The last 3 months, we continue to work on it on a daily basis as we move forward this summer and are planning for next year. But again, it's that if we knew what we were planning for, we could do it most effectively. Commissioner Anthems?
Yes, thank you. We have been working with the federal government to understand what their guidance is and their requirements are. At this point, I think we've been able to, at the state level, adjust some timelines, but I think Superintendent Siegfried is just right. This is very hard, and this is not an ideal climate to support some of our students that have learning challenges and many of our other students that are at risk. So we, in our toolkit and our guidance, we've suggested options that the superintendent just mentioned, which is prioritizing. If we can only get smaller numbers back in school, to prioritize the students with the largest needs, and those certainly might be our special education students.
Thank you. And next, let's go to an online question. We have Kim, and she has a question for Tara Hellman. Kim wants to know, if the potential of increase in COVID-19 this fall, does the district have a plan for remote learning for the fall quarter?
Thank you,
go
Kim,
ahead.
for the question. Yes, thank you, Kim, for the question. And as Superintendent Ewert iterated, we currently have a task force that is working on that furiously and tirelessly to really look at those accommodations, so that if we have to toggle, and I understand that there is great frustration around that. But also to the point of Dr. Siegfried, if we had a clear plan as to what we needed to prepare for, then we would be better suited. So we have taken the approach to try to be prepared for what is coming for the fall semester and certainly for the first quarter. So we're looking at all options and are building scenarios for those particular pieces. Thank you for the question, Kim.
Great, thank you, Tara. Next, let's go to Goldie, our live caller, and she has a question for Superintendent Siegfried. Goldie, go ahead and ask your question.
Yes, I am a grandmother taking care of my granddaughter, and I work full time. My husband passed away. I have nobody to really help me. My granddaughter is in special ed, and during this COVID, the distant learning was very hard. I'm not savvy to the computer, but we tried as hard as we could, and it's just not enough. I need somebody that could teach the parents to teach the kids. Is there any kind of program like that?
Thank you, Goldie, and I'm sorry, and I do understand the very specific impact, and I, again, sorry for that. One of the biggest learnings we had, or one of the learnings we had as an organization through this time, is we found that we had a lot of different platforms used by a lot of different teachers, and all of a sudden, when you have to use that too as a parent, that becomes very difficult to manage those. So we are making decisions to limit the number of platforms. So there are 2. And those are the only ones that any teacher will use. And we're also putting together videos that we can share out in July, professional development for our parents and for our students and for our teachers, so that whatever fall brings, we're all experts at the technology. So that training will be coming for you, for your grandchild, and for our teachers, so that the technology doesn't get in our way as we go to remote, as we go to online, or we go in person, or we toggle back and forth. So thank you for that question, and that was a big learning that we had as an organization over the last couple of months.
All right, our next question is an online one from Kirk, and this is for Dr. Douglas. What discussions are taking place regarding the negative mental health impacts on children wearing face coverings?
Kirk, that's an important question, and it's part of the larger face covering conversation. We are, I have to admit, we've been primarily focused on the respiratory issue and the communication issue, and less on the mental health, social isolation issue. But we are talking to pediatric colleagues as part of our Metro-wide Public Health Department collaboration to understand whether there are mental health elements in that we need to be considering. So I'd have to say that it's a good question, an important dimension, one that we're aware of but haven't dug in a detailed way at this point.
All right, and also Brian Ewert would like to weigh in on that question as well. Brian, go ahead.
Yeah, I think it's a great question. I think it's one that we really need to step back and examine closely. Most of us who have gone through training, we understand that probably about 75 to 80% of our communication is nonverbal through body actions and facial expressions. Now, it might be true that our secondary kids, middle school and high school kids, could be masked and probably survive that. It will be very, very challenging to teach reading and writing and mathematics to kindergarten, first and second grade kids if they are masked. So we really need to think about what that might look like in the primary grades. I have grave concerns about masking our primary kids, for a full day. And so whether that's a guidance or whether that's an order, we'll have to take a close look at that internally to see if that makes sense for learning. The bottom line is kindergarten and first grade teachers spend a lot of time looking face to face with kids when they teach reading. I'm an elementary teacher. I've been there, I've done that, and I can't imagine teaching a child to read without seeing their lips and their face and their mouth move and their eyes. It's all part of the learning experience, and that eventually will get right to the mental health issue as well.
Wonderful. Thank you, Brian. Next, let's go to Tim. Tim is in Inglewood. Either Katie or Brian, you can answer this question. Tim, go ahead.
Actually, I'm a Cherry Creek school parent, so I was kind of hoping to direct it to Dr. Siegfried, but whoever is great.
Of course.
We learned, my wife and I have 4 children in Cherry Creek schools, and we learned 2 important lessons last quarter. One was our respect for the job our teachers do every day went up exponentially because, as you can imagine, trying to do remote learning with 4 children at home is pretty daunting for us. So we understand the hard work they put in every day and really appreciate it. 2, we know now that we cannot do it again next quarter. With both of us in more than full-time jobs, we can't do an adequate job at home if we're in a distance learning or mostly remote learning situation next year. So I had a question based on the 2 premises we heard earlier. Dr. Douglas said that the Tri-County Health Department has no intention of being more restrictive than the state guidelines on going back to school unless the situation radically deteriorates. And 2, we know that Governor Polis's order on school attendance after his discussion the last couple of days is going to talk about a maximum of 25 students to a room. So if those 2 things are true, Dr. Siegfried and the others, why are we not starting with the goal of being all back in 5 days a week, 100% in-person learning with some adjustments and modifications based on what we think those regulations and guidelines are going to be starting the next couple of weeks?
Thank you, Tim. It's a great question. Go ahead, Katie.
Thanks, Tim. Tim, I did just want to clarify one thing. It's a great question, but the number of people in a room or classroom has not been determined. I do know that the governor made some comments last week, but those were sort of informal comments associated with knowing that we will have to evaluate the situation over the coming weeks. So we don't have that final number right now.
Thank you. And if that becomes the number, or whatever the number is, that's what we'll work to implement. Up until, and I heard of that conversation last week as well, if that's the number, it makes things like elementary much easier because most of our class sizes are 20, 22, 25, maybe a little bit above 25 in some instances, but that makes that very much easier. If it's a high school where there might be 30 to a little more than 30 in a classroom and kids have to change passing periods and they don't cohorts is another piece that to talk about as elementary students do, then we might have to treat secondary schools different than elementary schools. But I want to end by acknowledging where your question started. Our teachers are fantastic. They did a great job, and they always have, and I appreciate them, and thank you for acknowledging that. And also, I acknowledge the impact on you and your family and all the families in our country right now through that time. But when we get that final guidance, we will continue to work on it. But we started our work, our task force, about 6 weeks ago now, and because I can't wait until July to turn this ship and to get it ready for what you expect from me, and that's a great education.
Wonderful. Thank you. Let's go to our final question of this evening. This is an online question. Krista, and she is aiming this one at Brian Ewert, with Superintendent of Littleton Public Schools. Krista wants to know, what is being done to support parents who are choosing to homeschool because of the inconsistency of teaching?
Yeah, so that's a great question, and we do believe that we will have additional students and parents who choose the homeschooling route, and that has always been an option in our school district. When a parent signs up for homeschooling, that's a significant responsibility on the parents. They take responsibility for the curriculum, but we're there to support them. So the homeschooling question is actually being addressed by our task force as well, to say how can we better support our homeschool parents and teachers in an online model. So that will be probably one of the groups that's in the task force that's actually working on that particular problem.
Great. Thank you, Brian. Now, that is it for this evening. We have really enjoyed this time with you all tonight, and we hope that you have found it useful. Now, before we leave, we'd like to bring on our county commissioners on the line to wrap things up for us. First, we have Commissioner Nancy Jackson. Nancy, go ahead.
Thank you. And thank you all for joining us tonight. We hope it's been useful for everyone and especially for our families. Please let us know if you still have questions about anything, and we'll do our very, very best to answer as quickly as possible. And now I'm going to introduce Commissioner Jeff Baker.
Thank you, Commissioner Jackson, and thank you for everyone who joined us. We really appreciate your participation. We know that this has been a difficult and confusing time for everyone, and we appreciate your input and your patience as we begin reopening the county. I'd like to introduce Commissioner Bill Holman.
Thank you, Commissioner Baker. I want to present thank yous to the participants and presenters who joined us tonight. We've learned a lot of valuable information that we can use throughout the summer and into the fall. We will be holding these town hall meetings as new developments arise, so please keep joining us. I'd like to introduce County Commissioner Kathleen Conti.
Good evening. I also join my fellow commissioners in thanking all of you who were here tonight. As we begin reopening the county, there are still many hurdles to be cleared, and we do appreciate your participation and cooperation as we navigate this new normal. I hearken to the words of that my mom used to quote from Irma Bombeck, "Normal is just a setting on your dryer." But we also know how committed all of you are to keeping yourselves, your families, and your neighbors and friends as safe and as healthy as possible. Thank you again and for hanging in there and doing such a great job. And now back to our moderator.
Thank you, commissioners, and thank you all for joining us. Be well. And as a reminder, we'll post a copy of this recording to our website in the next 24 hours. Have a great evening.